my name is Abimbola Olaore. I'm a seasoned nurse. I'm an African. I'm from Nigeria, West Africa. I'm a wife, and I've practiced as a nurse back home in Nigeria before I came to United States. I am married with 3 teenagers, and this is Abimbola Talks. We talk about, our family issues, especially among immigrants, and also, as it relates to our mental health. We have done lots of episodes, so if this is your first time of watching me, welcome to Abimbola Talks. So this week, we are talking about conception as it affects our mental health. As a women's health nurse and has passion about mental health as it affects immigrants, because I know our perception about mental health is always about, it is not my portion. It is not my portion. So that is exactly why I am more concerned about the mental health of immigrants that lives abroad, especially women, and even also the men. I want to encourage all of us to make sure that we are concerned about our mental health. So this week we are talking about conception and mental health. I say when you come, start living with your spouse, if scientific says after trying for 1 year with no birth control and there is no conception, that means you are not pregnant yet. Go and see a specialist. Don't sit on it. Don't say, let me continue to pray. Yes, prayer is good, but faith without works is dead. That is what the Bible says. So if you have tried for 1 year and there is no conception, talk to a specialist. But if you have a medical condition, and if you have tried for 6 months, there is no pregnancy without any birth control, go and see a specialist. When I say go and see a specialist, I'm not talking about the woman alone. I'm also talking about the husband. So both of you, because you never know who needs a jump start between you and your wife, between you and your husband. So both of you has to go see a specialist. But you know what? Some people, they are pregnant from home. That means the husband went home, and by the time they come back here, the wife is already pregnant. This is very, very stressful. It's very, very stressful, both on your body and also on your mental health. So that is why I also hammer on the fact that do not be an island. Associate with people. You want to know where to go, where to register. Do you have an insurance? What kind of insurance do you have? Which hospital do you have to go? Which hospital is every hospital is good, but it depends on where you are living. Which one is more accessible? So you have to ask questions. Ask around, belong to an association, so that you can see people that looks like you, that are from the same place like you, so that you can ask the appropriate questions. So husbands, now your wife is pregnant. Pregnancy is not a disease, but it is a medical condition that affects every part of your body. Your mental, balance is very, very important, because it does affect your mental health. So you are pregnant. Some spit a lot, and this can be irritating to some spouses. Some vomit a lot. It can be irritating to some spouses. Some, they don't even want to eat. Some, they don't even want to hear any smell. So like when I was having kids, my husband, it actually know that I cannot use a cologne because I cannot stand a perfume. So we usually drive in different cars. So that is why I always tell people, one of my uncle will say, you are not helping in the house, you are doing your job. So peradventure, the husband, because he wants to provide for you, he wants to make sure that everything is fine. He also has bills to pay. He has to prepare for the coming, baby. And you just got to this country, maybe you have not even started working. Your husband will go to work from morning. He doesn't come back until in the evening. And you are by yourself at home in a foreign land. Well, thank God for media, for social media. You are able to talk on Facebook, on WhatsApp. But it's not like when you have your people around, you start thinking, what am I going to do? Am I even surprised that maybe they're going to have multiple pregnancy? Hey, all this has, a lot of put a lot of load on your mental health. And this boils down to the fact that you have to belong to an association. No one is an island. Allow people, ask questions, to ask people, where do I go? What do I do? So for your first we call it antenatal back home. And but in America, we call it antepartum, clinic, antepartum clinic and everything. So you go for your clinic the first time and they draw a lot of blood. Let me tell you, the doctors have to, they want to know your family history, which is most of the time, we don't even know our family history from back home. We just know that our grandpa died. We don't know what happened to the grandpa. Oh, my grandma died at the age of 90. You don't even know, do you have high blood pressure? Do you have diabetes? Do you have cancer? Because even most of the time back home, when anybody is sick, they'll say, oh, don't worry, the person will be fine. But most of the time, they don't even tell you the medical condition. So here in abroad, they want to take all the blood so that they can investigate, so that there's no surprise by the time anything happens. And also, if you come here with pregnancy that's already advanced, they want to know, they don't want to miss anything, just in case that anything is going on, that they want to, they want to find out so that we don't get any surprise. So these are the things. One of the things that freak out immigrants. They be like, oh my God, they've taken all my blood. I was there for 4 or 5 hours and stuff like that. And also the choice of delivery. I have talked to so many people. They be like, oh, they said I should do a C-section. C-section is the commonest surgery in the whole world, but it freaks out, many immigrants. I'm still going to talk about that later. But I just want to mention that. But predominantly, what I'm talking about is your mental health. So when you have probably, you have a history of mental health or in your family, or you've had, like some sort of depression or anxiety down the line, when you go, or whatever it is that you are feeling right now, when you go and visit a doctor, most of the time, OB doctors will just ask you, how are you feeling? Some establishments, now they have what is called a depression scale. They ask you, but, predominantly, very, very important, ask your doctor that this is how I'm feeling right now. I'm having, I don't want to talk with anybody. I'm being sad. Just let your doctor know how you are feeling. Most of the time, they will either refer you to a specialist, or if it's something that is, very subtle, if it's not something that, that is very, big, they can say, okay, let's give you a medication and let's start from there. Or they will tell you, this is what you are supposed to do. This is what you are supposed to do. In antepartum, we encourage our obstetricians to have what is called a depression scale. So they give you the scale. It has a yes or no, so it has different questions. So you fill out the questionnaire. So if there is anyone that ticks you towards depression, then they'll be able to know what to do. But most importantly, the husband, I know you have worked from Monday to Friday. And this also boils down to the fact that of being dominant, of being controlling, of being, like, oh, this is what you should do. Right now, please put your ego aside. Help this woman that is pregnant. She's not pretending. Don't be like, oh, she's pretending. Please, she's not pretending. Pregnancy comes in different forms. Oh, when my mother was pregnant, when my friend was pregnant, when my neighbor was pregnant, she was not, feeling like this. Everybody comes, pregnancy it acts on people differently. Some are speeders. Some carry cups around and they spit into it. Some are vomiters. They vomit every time. Some don't even want to eat at all. And some, they are bouncing around, they are cooking, they are eating. So pregnancy acts on people different ways. When I was being pregnant, I vomit, and when I vomit in the morning, that's it. Or sometimes I vomit, 3 times a day before I get myself. And I vomit all through the pregnancy, but some never. I know this can be irritating to some men, but please just make sure you don't nag, because it's not only women that nag. Men, they nag too. Some are perfectionists. They have what is called like subtle OCD, where they put their things. That is where they want it to be, to stay. Some even when you go to their house and lift a cup up and put it on the same place, they know that you have lifted this up. I want to tell you that you now have your wife in the house. Please step down, brother. Just hold on. She's pregnant. Let her, be. Support her. Whatever it is that you can do to support her. When you work Monday to Friday, on weekends, take her out. Let her, explore her environment so that she's not used, stay in the house again on Saturdays, on Sundays. Make sure that you guys, go around, look at things so that you have a different environment. And wives, make sure you keep to your doctor's, advice. Whatever it is, the medication that the doctor says you take the medication, and also pray towards it. Your mental health is very, very important. Whatever you are feeling, discuss with your husband. If your husband is someone that nags a lot, tell him that I'm not pretending. This is what this pregnancy is doing on my body system right now. Talk about it so that both of you can be on the same page. Ask questions. Don't be an island. And don't think, I tell people, your doctor, your pastor, your alpha, your imam, they are not trained mental therapists. They are your spiritual leaders. If you are feeling any of the blues, well, they can counsel you. And I encourage all the pastors that are watching me, and also all the imams and the alphas, please refer them to a specialist. Don't say it is an attack from home. It is your village people. No, it is not your village people. See a mental therapist and also pray, accordingly. The Lord will help you. And please take your medications. Don't say, I will pray. I don't have to take medication. No, that is what, Africans, immigrants do that make them, go crazy. Make sure you pray, take your medicine. Don't say it is not my portion. Well, now it is happening to you, so that it doesn't get to a point whereby it's going to be too late, where you be in a mental home for the rest of your life. Ask questions. Don't be an island. Associate with people. Talk about your mental health. Talk to your doctor. And husbands, help your wife. Support them. Do the things you can do in the house. Don't nag when you come back from work that, look at everywhere. And also, when you are pregnant, don't just sit in one place. Exercise. It is very, very important. Ask questions. Talk to people that are here before. I've been practicing in America for the past 13 years. That's why ask me questions. Send me questions to my DMs. We will talk about it. I'm not an expert when it comes to mental health, but I've done this work, this job enough to know people that are, susceptible. I've talked to Africans that I come across. When they come, I talk to them. How long have you been in this country? How many children do you have? When they open to me, I do not look for them, but I look out for my people. I ask them, are you Ghanaian? Are you Cameroonian? Where do you live? How many people support you? Most you'll be surprised. Many people will open up. Oh, I don't have people around. I don't know. I say, is it okay if I share your number with? I've called some of my Cameroonian friends. I say, I met this Cameroonian woman. Is it okay if I share your number? Then they will connect with them. Connect with your people. They are here to help you. Ask questions. Associate. You cannot do this by yourself. Pray and walk towards it. May the Lord help you. Thank you so much for watching this episode. If you have any question, please DM me at Abimbola Talks on Facebook, Abimbola Talks on YouTube, and at Sisi Bimbo, SISIBIMBO on Instagram. My phone number is public. Call me, send me messages. We'll talk about it. Down the line, we are going to be inviting specialists to come and talk to us about our mental health. Don't say it is not my portion. Walk towards it. Talk to your doctor and pray. May the Lord help you. And thank you again to Grace House Ministry for allowing me to use a beautiful studio.